In this study, we examine associations between both awareness and use of online booking of GP appointments in relation to sociodemographic and health status characteristics. Online booking of GP appointments is now available in nearly all practices via selection of websites and in some cases via apps. This facility is not new, but uptake has been patchy and slow. Both benefits and concerns about online appointment booking have been reported. However, this evidence is limited and little is known about the characteristics of those patients using online booking. I should say that all this work relates to pre-COVID times. Generally, online booking of GP appointments has stopped for the moment. We analyzed data from the GP patient surveys from 2018 and 2019. This is a postal questionnaire sent each year to 2.3 million patients. Both surveys had approximately a 33% response rate, and responses came from approximately 7,000 practices in England. In particular, we analyzed responses to these two questions on the survey. The first one let us know whether the patients were aware or not of the online booking facility in their practice, and the second one let us know whether they actually use this facility. The population of our study was restricted to those who report attempting to make an appointment in the last 12 months. For both outcomes, awareness and use, we fitted logistic regression models adjusting for all known and available confounding factors, and each model had practice as a random effect. There were 1.3 million responders to the GPPS in 2018 and 2019 combined report attempting to make an appointment in the last 12 months. 45% of patients were aware that their practice offered online appointment booking, while 16% had actually used this facility. These are some of the main results. The red dots represent odds ratios for awareness, and the blue dots represent odds ratios for use of online booking of appointments. Here we are looking at the associations of age with awareness and use of online booking. We can see that there is very little variability in those aged below 65. However, there is a big drop in awareness and use of online booking in those aged 75 and above. For ethnicity, we have a more complex pattern. The baseline group here is white ethnicity. We can see that although mixed and Asian patients are less likely to be aware of online booking than white patients, when they happen to be aware, they use it more than white patients. Here we can see a strong deprivation gradient for both awareness and use. The more deprived a patient group is, the less likely it is to be aware or use online booking. These are the odds ratios corresponding to the binary variables. We can see, for example, that deaf patients are less likely to be aware of online booking, but when they are more likely to use it. There was evidence of substantial variation between practices in terms of both awareness and use of online appointment booking. If we compare the best practice with the worst practice and calculate the odds between the worst and the best, we get huge odds ratios. These odds ratios are much bigger than any of the odds ratios corresponding to the rest of the variables. This implies that the strongest factor in determining your awareness and use of online appointment booking is the practice you are registered with. We found evidence of substantial variation in awareness and use of online booking by a number of factors. For example, strong deprivation gradients in both awareness and use may be a new digital manifestation of the inverse care law. Clearly, more work needs to be done to make online services work for the majority of patients. Given that practices are the strongest predictor of online booking, the most effective interventions may target those practices where uptake is low. We might question if online booking best serves the patients most in need of GP services. For example, online booking is great for younger people, but these are not the people using the service most often. Hence, digital innovations may widen health inequalities. Qualitative work as part of this study will examine the reason for the low uptake. It remains to be seen what the full impact of the recently developed NHS app on COVID crisis will be. Thank you for listening.